Welcome to our Nursing Clinical Skills Quiz. Let's put your knowledge to the test. In today's challenge, we're covering 4 essential areas of clinical skills: patient assessment and vital signs, emergency care, wound care, and medication administration. There are 3 questions per topic, 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. After each question, we'll give you a moment to think, and then we'll reveal the correct answer, along with a quick explanation. Ready? Let's dive in. When should a nurse begin their assessment on a new client?
Now, once we note the time, we need to start assessing the patient when we first see them. We need to make sure they're stable and make sure we lay eyes on them.
Which respiratory pattern is defined as fewer than 12 breaths per minute?
Now, you may see bradypnea, which is less than 12 breaths per minute, meaning this is slow.
A nurse suspects electrolyte-related pulse abnormalities. Which electrolyte imbalance is most likely responsible?
But sometimes we'll feel or we'll hear a pulse and it's really irregular. That could mean we have something called heart dysrhythmia, an abnormal conduction issue, a normal electrical conduction issue. This could be from electrolyte imbalances. That's our most common cause, such as a high potassium, for example. Or there's different medication interactions that can cause this as well.
Which assessment framework is emphasized for prioritizing care in patients experiencing major burn or trauma?
All healthcare disciplines are taught a similar acronym to help them prioritize care, particularly for patients who've experienced a major burn or trauma. ABCDE acronym helps every member of the team stay focused on the patient data that's most important. A is for airway, B is for breathing, C is for circulation and cardiac status, D is for disability, and E is for exposure.
Which assessment cue in burn management should prompt the nurse to prioritize circulation support immediately?
When you get that first set of vital signs, are you seeing signs of shock such as hypotension or tachycardia and pain? These are cues that you want to think about. We might need additional fluids. We might need inotropic agents. The reason when a client experiences a burn, they have massive fluid shifting. So they're at an extreme risk to have a low blood pressure and hypovolemic shock.
How many levels are included in the Emergency Severity Index, ESI?
Emergency Severity Index, this is a tool that's evidence-based. That means they've looked at research and outcomes and decided this is the best tool we have up to this point. So it's based on the severity of illness. It's also based in research. You're going to primarily use it in the Department of ER. So I call it urgent care, but we're likely thinking about a hospital ER unit. Now, the algorithm has you answer questions and evaluate the patient in a systematic way. This is going to give you all the clinically statistic information that you need about that patient's status, health, and healthcare needs. Now, it's going to put them into 5 groups. 1 is the group you do not want to be in, right? 1 is the most urgent. They go directly in, do not pass go. 5 is the least urgent, which they need care, but they're going to be waiting a long period of time because their needs are not as severe.
Which three main areas must be documented during a wound assessment?
So when we're talking about wound assessment documentation, remember there's 3 points that we need to look at when we're assessing a wound and make sure we document these. So the wound bed, of course, is the piece that's actually the inside part of the wound, and the edge, believe it or not, is important for us to monitor and document as well. Now, if you remember, this is kind of a funny word, but it's called peri-wound skin. This is the skin that's surrounding the wound, and it's important for us to document the integrity of that.
What term describes excessive moisture that softens the wound edge and increases skin breakdown risk?
Now, we talked about the wound bed. Don't forget the other piece of wound care assessment is the edge of the wound itself. So here, we're just focusing on that border. Some things that can happen if there's an excess amount of exudate or drainage, or the wound is super moist, we call this maceration. And this is a problem because the tissues around it can get really soft, too much moisture, and it could break down. This kind of makes me think of my skin if maybe I was sitting in water too long and my skin gets really soft. Well, the integrity of the skin's not as strong, right?
When is stoma paste most helpful during ostomy care?
Now's a great time to apply the stoma paste. And again, if you remember, this is really helpful if there's any little gaps between around the stoma and between the wafer, and this is going to help reduce leakage. So I'm going to take my stoma paste and just give a thick little circle around the wafer opening. And guys, sometimes it's not very pretty, but that's okay. Okay, so now I can get rid of my stoma paste. And you may need to just make sure it's applied around that area. Okay, so now that we've got this ready, now we can apply it to our patient.
Why should the nurse assess a patient before handing them pills in a medication cup?
Here's something else to think about. Some of your population, if you put the pills in the cup and hand it to them, some of your patient may have tremors, for example, or they may have poor eyesight and it's hard for them to see. So please assess your patient and keep this in mind. So sometimes you may give them a pill and they may be shaky and they can lose the pill in their covers and it's really hard to find. So please help them and assist your patient appropriately.
Which landmarking method is used to locate a deltoid intramuscular injection site?
All right, so today what I'm going to do is demonstrate a deltoid injection. I've talked previously in regards to injection that this is the most common site that you're going to use, and it's going to be in the deltoid, which is the arm. So let's talk about how we landmark that. So first, when we do that, we're going to try and take our fingers and find our patient's acromion process. That's going to feel like the really bony part of the top of the patient's shoulder. I like to creep my fingers all the way down to where I can find the edge of the acromion process here with about my third finger. Do about 3 finger widths down, and then right here is where I'm going to inject. The other thing you can do is kind of visualize a triangle of the deltoid, and you can go anywhere inside that triangle.
If multiple eye drops are prescribed for the same eye, how long should the nurse wait between medications?
And it's also pretty possible that you may have to give multiple eye drops to a patient in the same eyes. So if we do that, we want to make sure we allow at least 5 minutes between each type of medications if several eye drops are being used.
That's it for today's quiz. Count your stars and let us know how you did in the comments. Keep mastering those core nursing skills with Lecturio, and we'll see you next time.